Hey everyone, my name is Dr. Dolores Tarver. I'm a licensed psychologist here in Georgia, and it is time for the tea. Tea Time with Dr. Tarver is a wellness-based podcast. It is not intended to be a substitute for a relationship with a licensed mental health provider. Here we are in this last Thursday of November. I know you all are getting ready for those tomatoes and potatoes and yams and hams and all of that good stuff. But we are in caregiving month, and we have encouraged people this month to take good care of you. So we have talked about sexually transmitted infections, breast cancer, election anxiety, and it is my absolute pleasure to end this month with a topic that resonates for all of us because we all know and can appreciate a veteran. And so we want to make sure that we are giving space to our veterans in this episode as we bring to you the cost of serving veterans and mental health. So let me introduce to some of you and present to others, Mr. Lewis York, who is an Army veteran, having completed 21 years of active Army service. Thank you for your service, sir.
Thank you.
He is the father of 2 adult daughters and 1 adult son, and the grandfather of 3 granddaughters. Mr. York is a graduate of Liberty University with a master's in licensed professional counseling. He is a member of several organizations, including Kappa Lambda Chi Military Fraternity, Inc., the Lambda Dream Academy, serving our veterans and mentoring our youth, and the mission continues. He is also a member of Great Mount Zion Baptist Church, and currently Mr. York is a mental health counselor at Transformation Counseling Services in Columbus, Georgia. Welcome to Tea Time with Dr. Tarver, Mr. York.
Thank you for having me, Dr. Tarver.
Absolutely, absolutely. So we got a lot to get into. We're going to jump right on in.
Okay.
Now, we know that our veterans are experiencing a lot of things. Can you talk with us about what may be some of the mental health challenges that our veterans may be experiencing?
We look at a lot of literature. So a lot of literature out there, VA research and what have you. They tell you the predominant ones that our veterans are facing right now is PTSD and depression, especially after this, and we're still kind of in the after effects of the pandemic. So we've seen the incidents and the amount of veterans coming into our facilities kind of spike. But also we've seen it also that they isolated as well and have stayed isolated. So those are the 2 main ones. Of course, we have MST, which is military sexual trauma. That's both male and female. Anxiety disorders. There's a gamut of it, substance use and addictions. So there's a gamut of them, but for the most part, it's PTSD, depression that we get a lot of. The anxiety, yes, but a lot of it's the depression, PTSD.
Talk a little bit about, you mentioned quite a few things. I know some people are like military sexual trauma. I think you hit them when you said men and women, because I think a lot of times we believe that men are not sexually traumatized.
Right.
And so, let's go on and bust that myth right up. But also you mentioned post-traumatic stress disorder and depression. Talk a little bit about what that means. Like, what are some of the symptoms of that? What is PTSD, post-traumatic stress disorder? I know we throw that out around a lot. What are some things people may be experiencing with with military sexual trauma? So talk a little bit to our audience about some of the things people may experience.
Okay, and it might jump ahead just a little bit, but I just want to put the disclaimer out there. So post-traumatic stress disorder is not a military only disorder. Okay, so my example is always the 8-year-old that saw a car accident, given 6 months and more. If she's experiencing the effects of that trauma, she can have that PTSD disorder. But now getting back to the veterans, so what that is, I call it the unicorn, or that strange animal. It is still being researched, it's still being assessed, but you got a gamut of things that happen. What I've come to find out though over the years, not only as a clinician, but also being a veteran myself, is that the PTSD that I found did not start while in the military or post-military. A lot of researchers have looked at and has found that we've been carrying that stuff. So childhood trauma, other incidents that when you're growing up, being bullied, sexual abuse growing up, drug abuse, abandonment, all these other issues. Then you join the military, which the theme is to break you down to build you up. However, that psychological part there is missed, is not healed. And so the trauma is exasperated, or the military is a great distraction or a way to, I would say, positively vent. And so then when we have our veterans exit the military, now they don't know what to do with the stuff that they dealt with in the military and the stuff that came before the military. So that's one aspect. That's pretty much in a nutshell, the PTSD. The military sexual trauma is no different really than normal sexual trauma that we hear about in the civilian population. We just call it military sexual trauma because it's happening in the military. There's different things that oftentimes it can be sexual and non-sexual. It could be gestures. And yes, there's a high percentage of males with MST as well. But again, I call it the Western world's way of looking at it. You don't find a lot of males coming forward and just saying, I've been traumatized. And it's not male on male often. Oftentimes, I've seen it where it's males that have been traumatized by females. So those are some of the things that we're looking at as far as PTSD, sexual traumas.
Thank you so much, because I think it's very important for people to understand that we have a lot of risk factors.
Mm-hmm.
And so what people don't recognize is we're actually primed for trauma starting frequently in our childhood, in our adolescence. As you said, it may have come from our families. You mentioned the neglect, not even getting our emotional needs met, not being able to have loving environments where people see us, value us, tell us that we matter. But also there may be violence that we see growing up, could be in our families, could be in the neighborhoods where we are, could be on the TV screens. There's so much now that we're seeing with regard to video of violent footage of people that's become, we've almost gotten to the point where we're desensitized to seeing these violent images. But you also mentioned the sexual trauma that can occur in families. We know that kids often experience molestation and they don't talk about it. And so here we are now, I'm in the military and I'm exposed to some different things that are compounding this trauma that I've already experienced. And I also appreciate you saying, like, let us be clear that women sexually abuse men, males growing up as well as men, and even in the Army, and there's some shame that's associated with that may prevent people from talking about, sounds like, both their PTSD or their military sexual trauma.
Correct. And that's a lot of that shame is, again, is not just pointed towards the MST, but and like you said, PTSD. So is the shame, is the pride, is the trust factor. So when trust has already been broken, it's hard to trust somebody else. Which where I'm working at, there's a few of us that are veterans, and so it helps to gain the trust of another veteran. It's not always. People would think, well, a veteran would talk to another veteran. It's not always the case. You still have to gain that rapport. However, what I found is that it's less evasive when we can talk and I can understand acronyms, when I can understand where you've been. When you talk about you've been to the green zone, I'm like, yeah, okay, yeah, the green zone, yeah, remember that. And so now that rapport is there, that trust, we both have something to talk about. We're now in the same space, so to speak. And so now the bonding can become, the client and counselor bonding can become a little bit more solidified because the gain of trust.
That shared experience, if you will. And we were talking before we came on about having culturally responsive care, being able to go see a provider that's going to validate you, that you don't have to explain things or feel like it's being minimized. In a way, but that people can understand where you're coming from. And there's safety in that, because we deserve to be in environments that are safe when we're sharing things that are very personal, very hurtful, very deep. Because as you said, here I am, I have served this country, I have protected, and now here I am feeling like I'm falling to pieces, and I'm trying to understand why that is. And I've never
Mhm.
had to experience these types of symptoms before.
Correct, correct. And I think when I was doing a lot of research and then again from work, if you take a look at the statistics from the Vietnam War, comparatively to our last few wars from Operation Desert Storm, OEF, OIF, Operation New Dawn, it has spiked. The number of veterans with PTSD or any type of mental disorder has spiked, has increased, along with any other disorders. So we call them comorbid disorders. So they've got some other things going on, along with some medical challenges, which either impacts that mental disorder or that mental disorder impacts that and vice versa. So it's almost like I call it a tennis match going on with the veteran. And a lot of them are distrusting, I don't know if I'm getting ahead, because of lack of positive care. Again, you talked about the cultural, there's some cultural disparities there. Not just talking about cultural meaning African American, Latino, and all that, but the culture of military, of understanding the military, because a lot have come to me and said, I went to this mental health person and they said that, oh, just get over it, or it'll be okay. You're just holding on to it, just get through it, and it's hard because it's still a history that's been written into the narrative, and so now how do you help this person rewrite a narrative that they're the rewriting our narrative from the military, and then, oh, by the way, as we're unpacking that, we're finding out there's some other things that have compounded on that prior to the military. So it's a lot to try to just get through or get over.
And I think that is something that's very important to hear. Like, you don't get over trauma, you don't
Right.
get over depression, you don't
Mhm.
get over anxiety. You learn how to manage it, but it's not something that just falls off, that just disappears. There may be times when symptoms are better or worse, but they definitely are still going to be there. You mentioned some of the medical things. So talk about some of the other things that veterans may be dealing with comorbidly.
So a lot of the other medical things that veterans could be dealing with that are comorbid with mental disorders and challenges are things like blood pressure, high blood pressure. We've got a lot that are dealing with, as you know, the skin disorders, respiratory disorders. There are a lot that have come out with not invisible scars, but visible scars, meaning they're missing parts of their body, things of that nature. So again, that is just a bunch of stuff. Cancers. We had a lot of that coming from Vietnam, from the agents being used there, but there's a lot coming out of our present day conflicts, veterans with cancers, and also sexual disorders, infertility, things of that nature. There was a study one time that I saw that showed the number of women that exited the Army that no longer could conceive children. And so, it could be chemicals, could be the lifestyle of being in the military. And so that study it was a large number. I had done it a few years ago and looked at it and I was like, wow. So there's a bunch of other things that veterans now are trying to be seen for. So if you look at it, you got a veteran that's got a mental disorder, and they're probably coping the best way they can. But now they're looking at it, and as they're going through the process, they're discovering that I have multiple sclerosis, or because we have a lot of that, or I have this type of blood disease, or what have you. And so they're now trying to get help for that. But as we know, our healthcare system is exasperated, especially the VA system. And so it's hard to really get an appointment. And so what does that do? Especially during these past 3 years, while we were in COVID-19 isolation, they couldn't get an appointment. It was maybe a virtual appointment. And so now they're already isolated. They can't get medical care. So whatever mental disorder that they're challenged with, that they're trying to deal with on their own, now that becomes increased. That it becomes too much to bear for. And so
Go ahead.
go ahead.
Go ahead, finish your.
And so, now they're isolating themselves and don't know how to come out of isolation. The suicide rate spikes. Um, Substance use disorder spikes. And so there's a lot of things. And so when they are trickling out, they're having a hard time socializing now because, again, it's all about the trust. Can I trust you? Can I trust the system? Can I trust the healthcare?
And that's exactly where I was going to go because I'm like you mentioned fertility issues. You
Mhm.
mentioned, it's chronic pain. I might be missing limbs. I imagine sleep is all disturbed.
Mhm.
Your upper respiratory things. It could be skin disorders. I don't think we mentioned traumatic brain injuries, but I know that can also be
Mhm.
something that people are dealing with. So how do these things affect people in their relationships, at work, or, just in their activities of daily living when they're dealing with all of these comorbid things as well as mental health challenges?
It's a good question. So right now, I know our agency, we're discovering a spike in relationship counseling or couples counseling or marriage and family therapy. Um, and a lot of it is dual military, or we'll find is one of them is a military person, other one's civilian. And so it's how is it damaging it? Well, again, if we look at what COVID did, the isolation, a lot of veterans that have gotten out, um, they're already facing, trying to figure out how to adapt back into society, how to become a citizen again. A lot of them have, although they may have wanted to get out of the military and they're excited about exiting it, but that's all they've known for some of them for 15, 20, 30 plus years. And so now you put them in isolation and now they're in there with their family members. And so this things, there's communication issues, either lack of communication, and it grows because now we're sitting here together and we have nothing to talk about. How do we deal with our children? That's another thing. Being irritated and moody. You talked about the sleep disorders, so sleep disorders, and just not being understood. A lot of veterans say they just don't understand me. Been married for years, but there's a gap there in the understanding of what that veteran is going through. And even between two veterans, it can be a misunderstanding of what's going through because it's not a cookie cutter what we go through. Our depression is not a cookie cutter. Our anxiety, our PTSD. I always tell people if you ever watch the movie Vantage Point, that's a great analogy of we can all see the same thing, experience the same thing, but based upon my background, my development, and all these other circumstances is how I interpret that incident. And so one person might interpret it and they're okay with it. They can breeze through. Another one, and they're totally devastated by it. And so we're looking at that. What we found is a lot of marriages have suffered, and not just during the COVID, even before that, because of the length of the wars. They said that OEF, OIF were the longest standing wars that we've been through. Here you have now veterans that have gone deployed back to back, mostly all their career. And so they don't know what their family looks like. And so somebody asked me, said, well, wouldn't they want to stay home? They would, but when they become it's almost like a brainwashing. And when they've gone so many times, that's all they know is to go back into the box. And so the family becomes secondary and their soldiers become the primary family, unfortunately.
And I think you bring up some excellent points because I do think sometimes families will, right, perceptions are reality. Families will think you're choosing this over me, not recognizing that feels so much more normal to me than being here with you all. I've missed so much time with you. You have gone on and you have created these memories and had these experiences, and you have structured the household in a particular way with the order. And so I come back in and I feel like I'm out of place. It's almost like I was in a coma and I woke up one day and I'm trying to come back and I don't know you all. anymore
Mm.
because all this time has passed and I feel disconnected. I, may not have relationships with my children. They might have been so much younger during these times I left, and they've grown up, and so I don't know them. They don't know me, so it feels like a stranger's in the
So,
house.
a detachment has happened.
Yeah.
And so where you would think that a normal, what we call the normal family unit would be an attaching of some sort is a detachment. I think they saw this during the Vietnam, during the Hanoi Hilton. I read a book on Hanoi Hilton, and although a lot of the veterans that came back, they were going through what they call post-traumatic growth, a lot of them reported that they wish they could go back into that. And so you would scratch your head and say, why would you want to go back to that? Well, it became your norm. Your body assimilated to it, and so it became your norm. Your body assimilates to war and it becomes your norm. You're disgusted by going back and you complain, but that is all you know is how to fight, how to be aggressive. And so now we're stuck in the fight or flight mode. And it used to be the theory when I first got out of just turning the switch off, but I've discovered it's not a switch. Maybe at the minimal, it's a volume control, but it's not a switch because you just can't turn it off. It's now, how do I control it? How do I stay ahead of this thing?
And as you said, a shift is required because I have a different responsibility. So I have to tap into a different set of skills. You mentioned earlier, get broken down to get built back up, because there are a certain set of skills that you need to use here that wouldn't necessarily be helpful in your family, wouldn't necessarily be helpful at your civilian job, wouldn't necessarily be helpful in your church. But they're helpful in this environment. And so you're telling me, hey, this works really well and I'm great at it over here. But these are things that are causing conflict with other people in other relationships when I'm not in this environment. So yeah, I want to go back to the place where it works.
Right. And while you're saying that, Dr. Tarver, there's been a lot of work over the years on reintegrating veterans back into the family unit, back into the relationship. But then I'm wondering, I haven't seen a whole lot of work on how, and we know how the career counseling came about because of the World War II and all that, but I haven't seen a whole lot of how do I really help this veteran reintegrate back into the workforce. We have a lot of skill sets, loyalty, progress, order, things like that.
Problem solving.
Right, but how do you turn off the aggressive part? How do you turn that off when you're not talked to correctly? When the boss is saying something to you and you want to go off on them, and it's unprofessional in that environment.
Yeah.
And so I don't think a lot has been done for that yet, because that's where we're seeing some problems at. And a lot of veterans just refuse to say, I can't go back to work because I'm going to lose this job within a day or a week or whatever.
Right. And you're right, because vocational rehabilitation doesn't actually focus on integrating you in terms of these skills and how do I learn how to turn this off. It just helps you get employment opportunities.
Right. It just matches you up. Say, oh, you know woodworking because you did woodworking in the military, so we're gonna put you over here. But yeah, I know woodworking, but I've got a lot of anger built up. I've got a lot of depression going on. I've got anxiety issues. Loud noises.
Yeah.
Things of that nature. Or what do I do with flashbacks? And I had I had some issues with veterans who had to deal with even their equal opportunity, the HR that didn't know how to really handle them because they were having flashbacks and what have you. And so how do we handle that? And I don't think they really have a thorough understanding of how to handle a veteran. You mentioned TBI, which is a major factor. They still have the skill sets. I always tell veterans that you are not your disorder. Their disorder is just a product of the experiences and the trauma that you went through. But that's how we have to interpret it. But does the rest of society, does the organization that I work for, the corporation that I work for, do they understand it to that degree and can facilitate that? Maybe kind of pull me back and say, pull that veteran back and give them some space or maybe they'll have a better fit over here rather than here.
Yeah.
So those are the problems that we're seeing now.
And I
Now,
definitely think in some of our larger cities that have more, like you said, the research institutions that have more trained professionals that go into the companies and help with that. But in our, this area isn't necessarily a small area, but it's not large in terms of resources. So we
right.
are lacking oftentimes in terms of the resources that we have for those kind of integration things that would be more comprehensive. And like you said, and unfortunately, the population here then suffers. Now, I recognize we're going into the holidays. And so you mentioned a lot of things, these mood swings, being disconnected from people, nightmares and flashbacks. I'm kicking and screaming at night, checking locks and having my family all paranoid. And now the holidays are here. And you said the loud noises and all of these people. How may veterans be managing some of these challenges during the holidays? What are some things that they may be experiencing going into this time?
I think it's pretty much about the same that the same when we're talking about the negative coping skills. So pretty much the same that they will be using the rest of the year, maybe increasing it now. But again, alcohol, and also substances. So both illicit and legal substances. We know that there was a big opioid issue going on for years. And so that's the go-to. A lot of veterans will utilize that as a numbing agent, as a way to get away from it all. Even with marijuana and different things like that, they use that not so much to hurt themselves, but to get away from reality for a bit. And so coming up to this season now, a lot of veterans talk about have the memory flashbacks of another soldier member that passed away, or an incident that happened while they were deployed here or wherever. And so those things is hard for them to turn off. So what we usually do when we bring them in, we allow them to just talk about it. Just talk about it. Again, most of us in our agency are veterans, and so it's safe because we're not looking at them strange. It's been said that veterans use a lot of dark humor, and so whereas it may look a bit disturbing or sound disturbing to others, usually the veterans not utilizing that type of humor to be disturbing, but that's their way of coping. So is to laugh about it. And so allowing that veteran to be able to vent so they can feel safe, get it out their system. But right now we're probably seeing a lot of isolation. Again, when we talked about earlier is a lot of relationship conflicts, communication challenges, empty nesters as well. And so all those things kind of exasperate and impact the veteran right about now. So what I always tell a veteran is always have a buddy. In the military, we're taught, always have a battle buddy. And so definitely now have that battle buddy, that 3 to 5. So 3 to 5 people that you can call close confidants, that you can talk to, that you can sit by what we call the campfire and just chop it up and talk about it. Sometimes in my sessions, that's what they do. Some sessions is not about their diagnoses or anything like that. Sometimes they just come in, they just want to talk. And so I let them talk until they get tired. And then we kind of do a check on them and say, okay, how you feeling now? I feel much better, good. Because that's what we want you to be able to leave out feeling better, being able to tackle the day, not like you're back in war, not out of anxiety, but as normal as possible. Remember when I first started going to counseling, versus going to somebody else, the guy that I had was a prior service, and he told me, he said, no, you're not crazy, you just have a new normal. And I took that phrase and I understood exactly what it meant. It's a new normal. Yeah. So now how do I utilize that new normal in the rest of society?
And that's a good point because periods of adjustment, right? Being able to transition. We often say the word pivot. when we're talking
Mhm.
about, so I need to learn to move in a different direction because as you said, some of my battle buddies didn't make it. So I may have some survivor's guilt I might
Mhm.
be dealing with. There may be people at the family gathering that I've had some conflict with because I did get enraged and irritated when they said
Right,
something to them. So I cussed them out last time
right,
we saw each other. So everybody is wondering if I'm going to be explosive when
right.
I'm here, or maybe somebody came up behind me and I jumped and went to defend myself
Right.
because it took me back to this place,
Mhm.
where I had a flashback. And so I had to come back to, oh, okay, wait, this is Auntie Velma. This isn't me being somewhere serving, right? And so
Right.
as you think about for veterans who may be considering whether or not they want to go to someone's home for the holidays,
Mhm.
what would be some recommendations you might have for them?
Well, so we talked about negative coping skills. So the positive coping skills, of course, are mindfulness, um, grounding techniques, different things like that. So I kind of do almost like narrative with them and find out what makes them happy, what places make them happy, and things like that. And if they tell me like being on the beach, I'm like, okay, so on your cell phone, make the screen that picture. Myself, when I usually go somewhere, depending on where I'm going, I bring my headset with me. I may not be listening to anything, but I got it on my ears. We used to give out the bands so they could pop the bands. Breathing techniques, using breathing. Now, I usually use breathing with the 5, 4, 3, 2, 1 techniques. So I have them breathe, and I tell them, okay, 5 things that you can touch. I think it's touch first. And so I said, by the time you finish them 5 things you can touch and explain them to yourself in your head, you'll be tasked out. And some of them are leery about going, like you said, on Thelma. So I said, okay, prior to that, why don't we do something small? Why don't we go to the dollar store and just walk in? You don't have to go down the aisle. Just walk in and challenge yourself for 30 seconds to stand there. Or, just go on to Starbucks or something like that, something we call low key. Um, for those that gotta go do shopping because they're in a family and the wife or husband may say, hey, I need you to go shopping. Well, I can't deal with all those people in there. They go at a certain time. But now, Walmart is not 24 hours. So I may say, okay, go down an aisle and if you see somebody's in that aisle and you're not feeling right, then go down another aisle, come around. And then if that aisle is clear, then go there. But don't, I try to get them not to allow that thing to defeat them, but get ahead of it. And so we do it in small portions leading up to it. I've made a lot of progress with them. Another tool I use with that is journaling. I tell them to journal your feelings, journal it in the raw, just like someone that would produce a movie, they would write it out in the raw, unedited, with grammatical errors, cuss words, everything. Write it out and don't erase it, don't get rid of it. And then journal again the next time you go through that thing, in the next event, and the next event. And now you can look back at your progress, you can find where you were stuck at, and things like that. I like what you said, if they go back and, Auntie Thelma's like, oh, here he come again, he about to explode. Well, they only know you from an external part. And so the biggest thing we teach is self-awareness of yourself, understanding who you are, gaining an identity. Again, what you did is not, and what happened to you is not who you are entirely. I went to this organization called Warrior Path, and they teach post-traumatic growth, and they taught us about how the Spartans, before going to war, they used to go through the labyrinth. And so in the labyrinth, when they went into the center of it, because it's one way in, one way out, they would leave the family stuff there in the middle and then walk back out. Now they're prepped for war. Now, that's metaphorically, realistically, but what it did for them, it was a mind thing. And if I can control those feelings, those emotions within me and kind of, it's not a good thing to say, but compartmentalize because I have to at this point in
You
time.
do.
Then I'm fit for war. They would do the same exact thing coming back from war. They would go back through the labyrinth and drop everything there, and now go back within and into the population. And that's why a lot of them were called citizen soldiers, or because they were able to kind of make that difference. It doesn't take away from their skill set or what they learned. What it does, it gives them the upper hand on the memories, on controlling and having emotional regulation versus emotional dysregulation. So now they're better able to handle what they feel, process it, be slow to speak, sort of. So if something happens, if something pops, they're able to sit there. Okay, I'm using my skills. I'm getting my situational awareness, my bearings. Okay, that was just somebody dropping a thing of AIDS. Okay, I'm good. And even being okay with saying, hey, I'm it's too much sensors. I'm overly sensitized. I think I'm using the right word. So I need to go sit down for a while. And it's okay. It's okay. Regain who you are, regain yourself, refresh yourself, and then come on back into the crowd.
So
those are different things.
I didn't hear in there at all any avoidance thing. So all of those were active coping strategies.
Active, yeah.
And so like we know that when we use substances, that's an avoidance-based mechanism. When we don't go and see people, we avoid the stores, we don't, right? So these are mechanisms where what ends up happening is instead of me getting more desensitized to something, I'm actually heightening my hypervigilance. And so I actually make the trauma worse, make the responses worse because I never teach my body how to calm down. And so the techniques I heard you saying were like, these are calming things, the breathing, the grounding, which is like, let me connect with what I see, hear, feel, taste, touch. Those are what bring me into the awareness of this moment. And so I'm able to be present and recognize like, oh, okay, I perceive that as a threat. It wasn't actually a threat. So now I can adjust and respond accordingly instead of being reactive.
Correct. Now we do talk about avoiding. There's some things we need to avoid.
You do need to avoid something.
So sometimes because of the aggression, you might enter an area where you hear two people arguing or something. And so now I want to get in the middle of it. But the problem with that is getting in the middle of it. Do you know how to stop yourself? Or I have some that would say that some on their job, they were mistreated, mishandled. Or even if they go to a doctor's appointment and the way the doctor or the nurse would respond to them. And immediately they go into the aggressive mode. Immediately they go into wanting to defend and then next to attack. And so now we have to use the calming, but now how do I avoid this? So I might need to
stop it from escalating?
Right. So I might need to say, hey, I need to leave for a moment. I got to go to the bathroom. Doing something to get out of there, give yourself some space. Otherwise, you'll want to sit there. You'll want to, because it's a feel good. You're ramped up.
And get that rage back. Yeah.
Right. And it's hard. And so when that rage is up, a lot of veterans, they complain that, what do I do with all of this? I said, well, in war, we have something to do. We either you use your weapon or you did something to expel that energy. So what do I do now? You're telling me I can't expel that energy. I said, no, you can't. So what do I do with that now? And so we tell them some things like maybe going to learn boxing, exercising, but we tell them to do that within a means and balance based on their medical conditions and things like that. Because again, oftentimes we don't know how to turn it down. And so we're exasperate those medical conditions because we're trying to do so much, or we'll become workaholics. We've got a lot that will do, they'll support everything and they'll do a lot of work, but they never engage themselves. I got a couch in my office and I always tell them, have you sat down with yourself and had a relationship talk with yourself? They have a talk and support everyone else, but they won't and don't find the time to do it with themselves. And so that's a main challenge that I find with a lot of veterans, is taking that time to sit with yourself, to sit in yourself
Mhm.
And a lot of them, it's a fear
Yeah.
of what they're going to experience and so we allow our office to be that place. If they don't do it nowhere else, we allow our office to be that place where they can do it.
Yeah. To express those feelings, like you mentioned before, like let me talk about what's actually going on with me instead
Mhm.
of getting busy and not actually attending to myself, distracting myself by focusing on other people, not
Mhm.
focusing on myself. In order for
Right.
me to heal, yeah, it's uncomfortable. You got to hurt to heal. And so being able
Right.
to talk through these uncomfortable things, I heard you say before, sharing with family members, hey,
Mhm.
so these are some of the things I have going on. I need to take a little moment. I'm overstimulated.
Right.
Or, hey, please make sure you announce yourself. Don't just come up and touch me. Don't walk up behind me.
Right. Right.
Call my name first so you can orient me to your presence so I'm not
Mhm.
startled
Right.
when you're there. And what are some things that families and friends and coworkers can do to be supportive of
So
veterans?
that's a good question. So there's a lot I've watched over the past decade or two. There's a lot of programs out here. VA, if you go on their website, they have a plethora of different trainings that the family members, they have it for family members, clinicians, and for the veterans themselves. They can go through video training. There's brochures. There's a whole lot of psychoeducational tools out there. But there's also different organizations such as the Wounded Warrior Project, for post 9/11 veterans and or their caregivers' families. Warrior Path was another one. So there's a lot, and those are just a few. There's a lot of resources out there. If you just Google it, they're out there. Even on your military installations, usually if you go to by the, I think they're still called the Family Life Center. There's some there. I know at our office, usually if I'm dealing with a couple and only one of them is a background in the military, I would usually start off a little bit clandestine. I would start off with kind of if because I find that a lot of the conflict is a misunderstanding or the perception of the other one's job or what they're going through, and so use that time as an educational time. So we'll pull up a video or we'll have some other tools and materials to kind of educate them on it. Again, the education is not an overnight thing. It's a process of really understanding the person and things of that nature. But that's really what we would do for them. But there's a lot of resources, much more than before out there.
I dropped some of the ones you emailed me in
Mhm.
the chat, and
Right,
I know
right.
that oftentimes it is that lack of understanding that
Mhm.
leads to some of the miscommunication. And I also recognize that it's like you said, it's that shift from you being in an environment where language that you use,
Mhm.
the way that you handle things, like you said, more aggressively, that worked for you, that kept you safe, that kept order, that kept structure. But
Mhm.
then, part of the challenge, I think, for families and friends and loved ones is like that feels like a lot when you're giving it to me. And so I don't often know how to approach you or what to say or what,
Mhm.
so either we're going to escalate together
Right,
or I'm going to get to the point where I'm just going to avoid you. And
right,
I'm hearing you say that there is space for us to understand each other and be
right.
able to address these things in ways where we don't have to avoid each other as a way we deal with it.
And so it is a lot. Now, when I talk to couples in particular, I definitely utilize the journaling technique. And what I do with that, I have them do separate journals and to journal their feelings. And then you try your best not to have them discuss it outside of it, but I challenge them to bring the journals in, and I call it the vomit. I call it the vomit effect. I want them to pour it out there. We're not judging nobody. It's our perceptions and our feelings, and those are viable. We don't step on each other's feelings. But I tell them your feelings oftentimes is your emotions, plus whatever other stuff you're dealing with that could probably have a skewed vision of reality. And so we do a lot of putting your thoughts on trial, and we utilize that in it. So we have them utilize their journals, and then we throw it all on the table and say, okay, rather than finding what makes us so separate, what makes us so divided, let's find, even if it's a handful of things, the things that would connect us. Let's find the connectivity. And when we find that, then we pour into and we invest in that. And then I let them know, yeah, it is a lot. It's a lot dealing with trauma. It's a lot dealing with trauma, compounded with medical issues and doctor stuff and all this. And then we still got to deal with children and who's going to cook and who's going to pick up little Ricky from baseball. And so there's a lot. And I said, well, we're going to eat this thing one piece at a time, a little bit at a time. Just as it was a process to get here, it's going to take a process to undo some things and kind of together rewrite this narrative of how we want it to look. And it's not going to be perfect, but we're working our way towards a perfection so that we can learn how to communicate. That's the biggest issue, communication.
So when we are recognizing that someone we care about may need some therapy, because I do understand that we're talking as if veterans are all in therapy. We know that not all veterans are in therapy for various reasons. So when we're recognizing some of these challenges, what are some strategies you would recommend for people who want to talk to a veteran in a supportive way about getting some support?
Listening. Basic. You don't need a college degree for that. Just listen. Just sit there and listen. Oftentimes that's what a veteran wants you to do. Just listen. Don't judge me. And that also means how I look and what? None of that. Just listen. Just listen to the veteran, and be supportive in that nature. And then maybe if they open the door for what do you think about this? Still kind of hear them from their point of view as best as you can without judging. A lot of them they don't want to go to counseling. They don't, because it's too tedious. They don't want to open up and share all that. And definitely, there's not too many mental health organizations that also have veterans in it. And so it's not that they don't believe that a civilian can't help them, but that civilian does not understand them. That's the biggest thing you'll hear from them. They don't understand me. It's not that you're not credentialed enough or skilled enough, but you don't understand me. So understanding that the military is a whole nother culture by itself, wrapped with its own issues and problems and inconsistencies and all that. And so to have that understanding, to be able to be heard and not judged, that's really what I think. If someone's listening now and watching this and saying, how can I help my veteran friend, my veteran family member? Just listen to them. Don't push them. Don't give them the ultimatum. Now, there is times when when behaviors can look a little, I don't want to say dangerous, but to the point where there's some concern.
Yeah.
There's some concern there, and there's hotlines for that and different things like that. But for the most part, they just want to be heard. If we can try from that step of just listening, and then if they open up to you, just listen to their stories. Just listen to what they've gone through, and not placated. They don't want to. They can understand being placated, but just listening to them.
Yeah, I think all of us wants to be seen and heard, right? Because that suggests that we're worth something.
Right.
Someone pays attention to us.
Right.
And you mentioned some of these risk factors, so I'd be remiss if we didn't get into the isolation, the suicide piece for those people who don't have close support networks, that don't have Auntie Thelma to go to her house for the holidays. Let's talk a little about some of our veterans who are dealing with significant depression, isolation, and maybe at a point of feeling hopeless and worthless and desperate in their lives.
Again, I would say to them as one veteran to another, and again, to be open and vulnerable. I've gone through this myself, and so it's a daily fight. It's a daily fight. When I found that even in this career field that I'm in now, I found it to be very healing to talk to other veterans. Granted, I'm the counselor and they're the client, but it's healing to be able to talk to them, to be able to hear them, to be able to be share the same space with another veteran, regardless of if they're in the Army, Air Force, regardless if they're male or female, regardless, another veteran to sit in the same space. So what I would tell veterans is don't allow yourself to be isolated. Isolation is that monster that's trying to pull you down into that quagmire. Depression, if you look at it, comes from being depressed, a hole, a pit. And so allow yourself to be with somebody, whether it be by phone. And if somebody's listening, that's a friend or a veteran, call that buddy. Just call them and check on them. You know, a simple, hey, how you doing? You good, bro? You good, sis? Check on them and see what they need and see how they are. Things like that. That's what I would say. Because again, like you said, during this time, suicide rate has lowered, but it's still too high in the veteran population, too high. So those would be my, what I would say with that.
So connect to someone. So if
Mhm.
it's, reaching out to people that you served with previously,
Yeah.
Seeking mental health support services, crisis line.
Mhm.
But I'm also hearing you say to other people, when you see a veteran that is isolated, reach out to them, check
Right.
on them, ask them how they're doing, maybe
Right.
extend an invitation to them, so that they know that they're welcome, they're seen, they're valued.
Mhm.
And you had mentioned earlier just kind of finding where you fit,
Yeah.
essentially, like, so you're coming back in this transition. So it sounds like it also may be helpful for a veteran to get involved in something. You were involved in several organizations as we read your bio earlier.
So the reason why, as I was going through school to become a counselor, I had just gotten out, was a contractor, and so I dealt with the same issues. What do I do with my life now? And so I joined everything under the sun, and still connected to a lot of it. I can't do it as much with them, but there's so many. I know just in our area alone, the Phoenix City, Columbus, Georgia area, there's so many veteran-based or almost all veteran-based organizations that they can help out with. You've got Feeding the Valley with the Community Warriors. You've got the Mission Continues. You've got your American Legion. You've got another organization I'm with, supporting our veterans, mentoring our youth. I know Miss Love, she deals with a lot of veterans, helping out with Boys to Men. There's a whole lot of programs out here where a veteran can actually utilize their skills. And it doesn't, a lot of veterans say, well, I can't be around people every day like that. That's okay. Just if you go out just one time and just be able to influence another person. I started off, I was at Aaron Cone at the DJJ, and I was like, I can't be around these kids like this. I can't do this. And I had to learn my limitations with that, but I also fell in love with it because I was giving back to youth. Because now I went past my military career and I was looking at, okay, I'm Louis York growing up in Brooklyn, New York, East Flatbush in the 70s. What does that look like? What does it look like for them? We were the same. We were the same, just had decades worth of gap between us, but we were the same. And so pouring back into them. And a lot of times that's what a veteran wants as well. If I can pour back, because I don't know if I still have it. Again, some of the things we didn't talk about is the, TBI, one of them we talked about, but also the memory issues, the memory challenges, having problems with memory or other health issues. And so now I feel like I joke with it sometimes, like I'm that broken toy going to Broken Toy Island. And you're not. The one thing that you retain, I tell a lot of veterans, is your skill set, your skills, abilities, and capabilities. And you're able to pour back into society in one shape, form, or another. You may be able to do it 7 days a week or 5 days a week, but can you do it at some point And so what happens is not only has that veteran poured back, but now that veteran leaves out of there knowing that I've done something. I've impacted somebody else. No different than when we are out there on the battlefield. I've impacted. I've done something good.
That finding the why goes across
Mhm.
whatever you're dealing with,
That's
whether
it.
it's mental, physical, spiritual, financial. You find your why, and that gives you a reason for today. And so, I mean, one day at a time. So let me find a
Mhm.
reason why today to get up. Find a reason why I matter today.
Right.
To find something that gives me joy today. Find something
Right.
that gives me meaning and purpose today. And so I'm hearing you say that it matters for us to figure out what our why is.
Yeah, and that's what I do with a lot of veterans when I do the initial assessment and we go through the goals. What are your goals for therapeutic work and all that? I ask them, what is your why? Because your why will always be that anchor point, that ground that you can always go back to. So that way, when it feels like you're getting lost, feels like that storm is coming, you go back to that anchor point in your why. And a lot of them, they're like, well, I didn't know I like that. Well, now you know. And so then I kind of work with them and say, okay, we're going to do everything in moderation now. We're not trying to get you out there and now you're exasperated, but do it in moderation. And it helps them. It really helps them.
Yeah, having balance. Because I heard you say at first, I was like, oh, that's a lot. But over time, I was able to figure out what the balance would look like for me, and everybody's balance is going to look a little different.
Yeah, yeah.
Well, Mr. York, I want to thank you so much for sharing your experience. Again, thank you for your service, not only to our country to make sure that we were safe, but also to our country to make sure you're pouring back into our veterans. Right now, I appreciate the good work that you're doing. Is there any last words, remarks, anything that you want to share with people, other resources that we haven't addressed?
No, that's about it. We do at our agency, we do have so a lot of veterans, they're also dealing with ratings. So VA has changed a lot of things over the past years. I think right in the middle of COVID, they changed their third-party insurance and stuff. And so if veterans need help with ratings, there's a bunch of agencies out here. I got a good friend, he's part of VFAC. Then we have Wounded Warrior Project, they help out with ratings as well. And then we also have a lady that comes to our agency, Miss Sandra Brownlee, and she does that pro bono. She is not a charge for it. And she helps a lot of veterans. And we're glad we have her on our site because usually when we send veterans out, they never go in.
They don't follow through.
No, but when we have her right there, as they're walking out, I kind of skirt them down the hallway to her office. And so now you don't have, and they come back and they're like, wow, thank you for pushing me to go down there.
Yeah, it seems daunting.
It does. It does. It does. And we have a lot of, we got a few Vietnam War vets that is very daunting for them, but there's been a lot of success even with them gaining their ratings and stuff like that. So
tell the people where you work again, sir.
So I work at Transformation Counseling Services at 4411 Rosemont Drive in Columbus, Georgia. If you're familiar where St. Francis Hospital is, we're down the street from St. Francis, around the corner from this, where our CEO and founder is Dr. Sabrina Lopes. And in our agency, we have 1, 2, 3 prior services, including me, our front desk. And so we'll be glad to see we're paneled for a plethora of insurances to include Centerstone, which is they are contracted with Wounded Warrior, MOS, VA Optum, Blue Cross Blue Shield, a bunch of them. So come on by and see us.
All right. So everybody, you have heard the resources. I've dropped some information in the chat. We want to thank Mr. Lewis York for coming on Tea Time with Dr. Tarver. We're going to be picking up with our December episodes that are going to focus on health and the holidays. So we look forward for you to join us in December as we continue on this wellness journey. Mr. York, you have a happy Thanksgiving, and everybody, the same to you, and be well.
Thank you.